Hello, everyone. Welcome to a Matter Startup Showcase, and more importantly, happy International Women's Day. I am Stephen Collins. I'm the CEO of Matter. We are a healthcare technology incubator and an innovation hub built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. At this event, at our Startup Showcases, we pick a topic and then invite 3 Matter member companies to present their solutions to a panel of industry experts. Today's program focuses on solutions in women's health, an area that has long been underappreciated by investors, but has really begun to come into its own in the last few years. The femtech market is around a $40 billion market, depends on which source you look at, but at least a $40 billion market and growing rapidly. Driven by a variety of factors, not the least of which is the increasing comfort of investors and others in talking about the area. In the last few years, we've seen multiple funds formed to invest exclusively or primarily in femtech solutions. We've seen conferences spring up, podcasts, forums, really formed to connect people, spread ideas, and entrepreneurial activity is on the rise. I am delighted today that we have the opportunity to present 3 member companies that are developing solutions to improve women's health: Ember Labs, Partum Health, and Unifi. We also have 3 experts here with a strong pulse on the market dynamics who will ask each of the entrepreneurs questions following their presentations. Sherry Crow is the Director of Women's Services at Baycare, which is an integrated health system based in Tampa, Florida, with 15 hospitals. Supriya Lakhniti is the Executive Director of Virtual Care at CVS Health. She's been with Aetna and then CVS since 2015 and previously ran women's health products for the company. And Sarah Allen is a product development design principal at Evernorth, Cigna's brand that accelerates the delivery of innovative and flexible solutions to meet the diverse needs of health plans, employers, and government organizations. So with that, I will turn it over to my colleague, Casey Sheridan, who will MC the program.
Wonderful. Thank you, Stephen. With that, we'll get right into the pitches. So first up, we have Liz Gazda, who is the CEO of Ember Labs. Liz, whenever you're ready.
Good afternoon, everyone. Thank you so much for having us. And Stephen, thank you for hosting such an important event at a time when we really need more women around the table and feeling healthy. I'm really passionate about sharing the therapeutic power of temperature. This is what we're about at Ember Labs. Ember Labs was founded out of MIT here in Boston. We've been around for a long time studying the therapeutic power of temperature. So since 2014, today we're 25 people. Our technology has been validated by J&J, and we have customers in 170 countries around the world. The woman we serve is the menopausal woman. By 2025, there will be 1.1 billion women in menopause, and they will suffer from a whole host of symptoms: hot flashes, insomnia, anxiety, and brain fog for a decade or more, with no real solution. And today, women are spending about $2,000 a year out of pocket for what are really inadequate solutions. The Ember wave uses temperature as a unique neural pathway to the brain to balance the autonomic nervous system. And all of those symptoms that you saw on the previous slide are really an overactivation of the sympathetic nervous system, or your fight or flight response. So it's not a good feeling. What we do is we apply thermal energy to the skin to balance that autonomic nervous system without any side effects. So a real natural, holistic solution and harnessing the body's own pharmacy. Imagine our surprise in 2021, in October of last year, when we woke up and saw that the Nobel Prize in Medicine and Physiology was awarded to the scientists who originally picked up on the power of these thermoreceptors. We have patented and commercialized a solution that unlocks this power to bring this to women all over the world. As a company that's rooted in science, it's always been critical for us to understand and validate our science beyond the placebo effect. So in 2018, excuse me, we were lucky enough to partner with Johnson & Johnson Innovation to look at the impact of the device on hot flashes and sleep. And what we saw was incredible. We saw a 168% improvement in hot flash control, a reduction in hot flash interference, and an improvement in the insomnia severity index. This is really incredible because we took the same measures that pharma would use when looking at pills, and we were able to prove out this efficacy. While the clinical evidence is really important to us, nothing speaks louder than the traction that we've achieved. Today, we are the leading natural hot flash solution. We've sold tens of thousands of devices and captured tens of millions of dollars in lifetime revenue. What's really stunning is that we only sell this product on our own website in the United States, yet the product has made its way into 170 countries around the world. So people are shipping this abroad and paying customs on it. But most importantly, our customers describe this product as life-changing. And today we see that our customers have logged over 200 million minutes of thermal interventions. This has really captured the hearts and minds of menopausal women, and what we see is just unprecedented engagement. So today, using the product, we're seeing 4 to 5 hours a day on average of engagement with our product. And if you compare this with other platforms that primetime women are on, it really just exceeds all measures. We engage with these women because we deliver real relief and real value. Our customers describe the wave as life-changing and having a positive impact on the quality of their life. We are able to reduce hot flashes, improve sleep, and reduce stress and anxiety. Through the interaction with primetime women, we have really gained a privileged understanding of women in menopause. We understand the journey. We can predict what they're going to go through. At the same time, we are providing real value in terms of relief, control, and trusted insights. Today, we're on a rapid trajectory to unlock growth. This is our second generation device that has been now adopted by tens of thousands of customers. We're growing revenue at a rate of 350% year over year. This is the product we'll take global, and we'll be launching premium product features to drive recurring revenue. Most importantly, we want to expand this product line beyond menopause to the general population to bring this technology in as far and wide as we can. Not surprisingly, we've been approached by brands and CPG because they're very interested in the power of prime time. This is a segment of the population that has really unrivaled purchasing power. They make 80% of the healthcare purchasing decisions, 93% of the over-the-counter pharma spend, 90% of the healthcare decisions for their extended family. They own 89% of the bank accounts. And we need to get ready because by 2030, 25% of the world's population will be prime time. While we're passionate about helping the individual woman, we're also very passionate about looking at the bigger picture. 80% of women say that menopause interferes with their daily life, and 50% of women say menopause has made work difficult or even untenable. What does this mean? What is the real impact of untreated menopause? Well, if you look at the cost to organizations, it's about $6,500 per woman per year for employers. Women with hot flashes have 60% more lost work productivity days, and it's been estimated that the global productivity loss can total over 150 billion. Women are spending a lot of money for solutions that don't work. I mentioned $2,000 a year out of pocket. They're utilizing a lot more healthcare, and it has a huge impact on the cost of serving these women. It's estimated that the combined cost is more than $810 billion. But what we're really thinking about is the unquantifiable cost to society. And today, on International Women's Day, it's a time to consider what the societal impact is of menopause. We think of it as the female brain drain, because women in menopause are in key strategic leadership roles. They're running corporations and boards. They're in key government roles. They're in academia and research. They're at the prime of their career, making the most money that they've ever made, rich in experience and influence, and highly trained and invested in. But we also know they're ready to walk out the door due to menopause. We don't ask them very often. There aren't too many surveys about this, but those that do answer the surveys tell us that 1 in 10 are considering leaving the workforce due to menopause. At Ember Labs, we're on a mission to empower primetime women everywhere to reach their greatest potential during this most influential time of their lives. Thank you.
Thank you, Liz. At this time, I will ask our 3 panelists, Sarah, Supriya, and Sherry, to please come on camera and go ahead and ask Liz your questions.
Thanks, Liz. That was, first of all, amazing. And as someone, frankly, myself and my peer group who are entering that phase, it's really nice to see that there is new technology that's going to be helping, because it's much needed. So my questions are actually really around the business model. I would say it sounds like to date, it's been much more of a direct to consumer model on your website. Mm-hmm. Have you thought about going, either the B2B route, right? So whether it's, to employers who obviously are feeling the need for this as women are exiting because of menopause. Have you thought about going that route, or, have you thought about using other channels? It could be through OBGYNs, maybe other companies that don't have a device, but have more of a digital tool. So just wanted to understand that more.
Yes, I would say yes to all of the above. So we're keenly interested in partnering with employers to help this population of women. We will also be working with retailers to take the product far and wide. We presented at NAMS last year, the North American Menopause Society, and what we saw was that OBGYNs and practitioners were very keen to recommend the product to their patients, especially because many women cannot tolerate hormone replacement therapy or want to use it in conjunction with HRT.
Thank you.
You're welcome.
Hi, Liz. Thanks for the time today. 2 questions for you. So what changed from version 1.0 to version 2.0? What did you learn in that evolution? And then what are people doing on your app for 4 to 5 hours a day?
We made fundamental changes to the product between the Gen 1 and Gen 2. The generation 1 was a little bit bulkier. It was heavier. We improved the cooling mechanism. We improved the battery life. So you get a lot more usage out of the device with higher efficacy in terms of the warming and cooling. But the biggest change for our users has really been the form factor. It's lighter, it's more wearable, and it's modular.
What does that mean, modular?
It means that in the future, we can do different things with different bands and accessories. So you can take it off the band and customize it if you wish. In regard to the interaction with the app, primarily they're looking at what the symptom tracking, looking at their utilization, but also moving between the different modes, because we offer a hot flash mode, we offer different sleep modes. And so they're changing the different types of interactions. Is it a shorter duration? Is it changing from warming or cooling, or the waveforms that we apply to the wrist?
So if I put it on sleep mode, is the device doing different things while I sleep? Is that how I should interpret that?
Yes.
Okay.
So we have 2 sleep functionalities. One is a fall asleep mode, where you're put into a 30-minute mode where the waveforms slow down, much like your breathing slows down over the course of 30 minutes to kind of lull you into sleep. And you can choose that either in cooling or in warming. We also have an all-night mode, which allows you to deliver a longer waveform that is more prophylactic. So women and men who experience hot flashes or night sweats tend to use the all-night mode as kind of a prophylactic measure.
Thank you.
And I say men because we've discovered that men undergoing prostate cancer treatment are greatly affected by hot flashes and night sweats.
Hi, Liz. Thanks so much for the presentation today. So when you look at your product, who do you see as your competitors in the current market? And, you know, are there competitors out there, and how are you addressing the competition?
We see the real competition is hormone replacement therapy. So, you know, some women choose to go on hormones and estrogen replacement. That will dampen down some of these symptoms that they're feeling. There are a few other companies that also recognize this opportunity and are working on it, but we haven't seen them come to market yet.
Thank you.
One question kind of to follow up on that. So I guess these days there's so many different devices that one can have on their wrist, right? I mean, everyone has an iWatch. If you're running, you might have something else, right? It's clearly this is like meant for sleeping, or correct me if I'm wrong when I say that. Is the goal to, I mean, let's just take, is the goal to say that this device is for women going through these symptoms and then wear the device only when they sleep, or is it meant to be a wear the device all the time? And if it is wear it all the time, then what about actually using the technology in and integrating it with existing wrist devices that folks are using?
The technology can absolutely be integrated in existing wearables. So we'll start there. What sets us apart from other wearables is most wearables are trackers. So they tell you how you sleep, they tell you how you walked. And once you develop those habits where you recognize, oh, what 10,000 steps feels like, or a good night's sleep, it can go in the drawer. We're delivering a therapeutic, it's a haptic therapeutic, and our customers have described this as so life-changing. And those are really the words that they use, that I can finally experience life again, that they don't mind wearing it alongside other devices or even replacing them.
So to Supriya's point, are you interested in a Intel inside distribution model? If that makes sense, like where you're the technology embedded in certain products?
Yes, and we have identified through the real world evidence that we've gathered through our population of users that there are other applications that are very compelling that might be of interest to pharma. And in those cases, what we would like to do is license the technology to pharma to take this to market.
And then one last question, if you touched on it, I apologize, I missed it. Your subscription model. So I'm assuming the device has a cost, and then is there a monthly subscription? And do you find, and I know you haven't been around, you know, potentially 10 years, knowing that menopause can last 10 years, but interested if you're comfortable with the drop off once people have exited the menopausal period into post-menopause, or are you focused on an engagement strategy post-menopause if you're seeing this type of engagement?
Today, it is a one-time sale, and this year we will be releasing recurring revenue. I think the art here is to really identify what is of value to our users, and that's what we're working on today. And speaking to like the drop-off after menopause, the technology is very effective for sleep and stress. And so I see that that is a very important application for women who are postmenopausal, and even looking at the elderly population. This is a population that has a lot of trouble with sleep.
Thank you.
Thank you.
That brings us to time.
Oh,
So thank
sorry,
you so much.
Sherry.
Oh, do you have a quick question, Sherry?
Well, it might take more time. I was just wondering about what the legal and regulatory risks that you see are for your product.
Yeah, we're a wellness device, so we don't really see any kind of regulatory risk. We've been through a full analysis on it, but we haven't identified any risk. Thank you.
Wonderful. Well, thank you to our panelists, and thank you, Liz, for sharing a bit
Thank
more
you.
about Ember Labs with us. Awesome. So next up, we have Megan Doyle, who is the founder and CEO of Partum Health. With that, Megan, whenever you're ready.
Excellent. Thank you so much. Really excited to be here today on International Women's Day, and always so inspiring to see others making changes in this field, because it's so needed. There's a lot of work to do. As Casey said, I'm Megan Doyle. I'm the CEO and co-founder of Partum Health, where we are focused on building whole person care for growing families. For those of you who have children or who have loved ones who've started families, I want to start by asking you to take a moment and think about what it feels like to become a parent. I know for me, I do think of cozy snuggles and that special newborn smell, but I also think of feeling really uncertain, being afraid of labor, feeling physically uncomfortable and overwhelmed. And at Partum, we've talked to hundreds of parents and providers, and what we've identified is that there is an incredibly common set of needs that new families experience as they start and grow. These are needs that not the best OB or midwife alone can really serve, but there are experts who can, and lack of access to that care is really contributing to the lagging outcomes we see in maternal health overall. And that's affecting the experience of more than 3.8 million families who are welcoming a new child each year. And despite the $110 billion we spend on maternal and infant health in the US each year. So at Partum, we're really focused on building on these insights, taking inspiration from models around the world, and really asking the question, what is the best care experience that we can possibly deliver to every growing family? We believe that expert care really starts with a team, and we focused on these 5 core services that complement the obstetric care that most families receive. And these are 5 services that have demonstrated impact on both health outcomes and are in demand by parents and families. So that includes doula care for both birth and postpartum, physical therapy, feeding and lactation support, nutrition, and mental health. Each of these services has been shown to be effective in both preventing and addressing the most common health complications connected to pregnancy. And with these 5 services at our core, we also see opportunity to continue to expand as we aim to really be a one-stop solution to support all families during this phase. We also believe that delivering this great care really stems from a deep understanding of consumer expectations. Parents today are looking for 24/7 care and on-demand access that has to really span the gamut from digital self-serve content, texting with expert providers, telehealth when it's convenient, and importantly, in-person care with those services that are best delivered live. This combination positions us to really continually improve our overall hybrid care model and to think about creating a most cost-effective way to achieve these superior outcomes and supporting families to get access to that care that they need. In our first year in market, we made a huge impact with the families that we served. This quote from first-time parent Allie M. really brings to life the way we want all families to feel as they start and grow. We want them to feel joyful and supported. But our care is actually more than just creating joy. It's also life-saving. In the words of another Partum patient, who had a serious postpartum complication identified in her first few days after discharge during a visit with a partum provider. We know that it's really important to continually track and improve on this experience, and we have been tracking with a net promoter score in the 90s since our launch. And this is across the hundreds of visits that we delivered in our first year in market. Our team really brings to our experience founding Partum Health, our lived experience starting our own families. So both my co-founder, Matt Rogers, and I lived through a lot of these gaps. We cobbled together our own care teams, and we bring that experience with us as we have started the company and continue to work with that in mind every day. We're also joined by an amazing clinical team. We have a chief medical officer who we are formally announcing later this month, Autumn Perot, who has spent her career in maternal and infant health. And we've assembled a team of more than 20 expert providers who are delivering care here in our home market of Chicago. We've also got a fantastic group of advisors who are bringing experience across healthcare startups, digital health, as well as domain expertise in perinatal care. We have big ambitions at Partum Health to really create team-based care and to make it accessible for every family, redefining the standard of care for families who are starting and growing. We are today focused on expanding access through a coordinated care model in a direct-to-consumer launch. We then will be expanding across new geographies and then growing our B2B partnerships and expanding into bundled care options as well. And last, as I mentioned, expanding our service and products so that we're continuing to serve the families that we work with for longer periods of time, starting with this period from preconception to pre-K. Really important across that journey is for us to continue to innovate on our hybrid care delivery model. These pathways are really important across each specialty and also as a whole so that we can deliver a cohesive and cost-effective experience for families. Thank you so much for the time. We are really excited to be this year, hopefully raising our seed round later. We are always looking for collaborators and partners, and we encourage you to please reach out. There's a lot of work to do in women's health, and we believe it's going to take a whole village of us working together to make it happen. Thank you.
Thanks, Megan. Sherry, Supriya, and Sarah, whenever you're ready.
I can start. Thanks, Megan.
Okay,
Go ahead.
No, all you, go for it.
That always happens. Thanks for sharing, and thanks for bringing this important work forward. I'm interested in why you chose the hybrid model, and where my question comes from is I see a lot of maternal health, whether it's pregnancy, postpartum, fertility, and they stay in the digital space. And a question I always have is like, what if someone needs more? And so I'm interested in why you chose the hybrid model. I think there's pros and cons. I think there's also added complexity that you've signed up for. So can you walk me through that?
Yeah, definitely. It's a great question. I would say the two main reasons. The first is what you mentioned, right? Whereas a lot of the competition today, they've clearly started with a focus on digital platforms, on access to information, and that is really important. As you probably heard, we really start with the consumer with pretty much everything we do. And what we found is that for a lot of families, what they were really lacking was not access to information, right? But was like hands-on help and practical support. And there are services that are really commonly needed by families, so including lactation, birth doula support, that we believe have a digital delivery mode that can be useful, but it's not useful in every situation. So we heard loud and clear from consumers that needing to have somebody who can be there in person, who can demonstrate hands-on, is really important. And then the last thing I will say is I think, we're trying to create a cohesive care experience for consumers as well. And knowing the way that a lot of traditional obstetricians and midwives really build their network and referral network, having locally based care teams, we think is really important to enabling that experience for consumers too.
Thank you.
I have two questions around this model. So I think you're right. There's a lot of established players like a Maven comes to mind where they do, family planning all the way to postpartum and truly are focused on digital. Hybrid obviously has a lot of benefits, but in terms of operationalizing it, I was wondering, one, I guess if you could explain that a little bit more, are you actually, I know it's a direct to consumer model, but are you working with your consumers on their insurance provider, sending them to in-network care? Is that kind of the model? And if so, I'd like to just understand, how that's working out. And then second, how have you thought about scaling with the model like this?
Yeah, great question. So on the first, we started, it was really important, I think, for us from the beginning as we think about our mission, which is to change the standard, was not to start with a full cash pay model. So clinical care is typically run through insurance. We started in a partnership model with our providers, with the clinicians, and then we are migrating to more of an MSO PC setup so that we can really do end-to-end billing and reimbursement on behalf of the patients. There is, of course, non-clinical care. So postpartum doulas, while amazing, are not yet covered by most insurance plans, but I think we see really promising indications that some of this practical support, and birth doulas as an example, I know CVS actually has specific reimbursement for that service. We believe that trend is going to continue. So we're always focused across both the non-clinical practical support and the clinical side, and for the clinical, focused on helping folks utilize their insurance and reimbursement. And then your second question was around scaling. So we are definitely, as you mentioned, there's complexity to having multiple service lines and to having multiple forms of care, but also that's kind of what's demanded by consumers and patients today. We have built a team here in Chicago, and we're continuing to grow that team and building that backend infrastructure that will allow us to then replicate in additional geographies. There are some services that, of course, will lean more heavily onto telehealth, including nutrition and behavioral health, where we will likely scale more centrally. And other services like lactation and birth doula support, as I mentioned, where you're going to want boots on the ground and folks who can show up and help you. I don't know if any of you are familiar, but we've talked with lots of parents who've tried to do lactation visits with a partner holding a phone.
Yeah,
and
very well.
Yeah. So there's a lot to improve on, I think, in the digital experience, but we always believe that having that in-market presence for in-person delivery where needed is an important part of how we'll scale.
Thanks.
Do you see yourself partnering with healthcare systems, with more individual providers as you begin to scale up? You move into a new state. How will you approach that?
Yeah, that's a good question. And I think one that, we see multiple avenues depending on the market. In terms of the health systems, like some have more focus on specialty care, right? Because a lot of this really is, you need perinatal specialists who focus on not just behavioral health, but perinatal mental health as an example. So there's a little bit of variation, I think, in how different health systems, like what is their starting point and what's their breadth and how fragmented is the market, frankly, to start. But what we've seen so far is that there's a pretty strong untapped demand in the market, right, on the consumer side. And from just a handful of individual relationships and outreach to providers, as well as some minimal direct-to-consumer marketing, like you can actually reach a lot of families who are actively looking for this care. So we're currently building referral relationships and partnerships more focused on individual practices here, but we absolutely see opportunity to expand that and work with health systems on a larger scale.
And what you we're starting to touch on it. Oh, Casey, am I out of time?
Go ahead.
Okay. What's your customer adoption strategy? Like you said, a little bit of marketing. How are you finding your families?
Yeah, so what we found by and large in our initial research is that families who are expecting, they have two primary sources of information where they say, okay, you tell me to do it, and I go out and get that support. And it's usually a close circle of friends or family and their physician, right? And so we've really focused on how do we make it easy for families to tell other families. And actually, we got a lot of our kind of pilot group of customers just from word of mouth. Like I mentioned, families are also actively looking. So when their therapist says, hey, it sounds like a doula might be a beneficial addition to your care team, right? The first thing they do is go online and find local doulas. And then on the second side, the obstetrician or the midwife is a really essential part of providing recommendations. And so we're just scratching the surface there of building awareness here in our local market. But it's something we've gotten really warm receptions because frankly, for a lot of obstetricians, a lot of the questions they get are kind of outside their scope of practice, and they have limited time to address things like your pelvic floor function, right? Or lactation questions. A lot of them will tell you they never really were trained in lactation. So for them, having a trusted partner that isn't, simply a single provider, but rather a group where they can get access to a multi-specialty approach, we found has a lot of appeal for them.
Thank you.
Thank you so much, Megan.
Thank you, guys.
And with that, we will move on to our third and final pitch of the day. So Mylene Yao, who is the co-founder and CEO of Unifi. Mylene, whenever you're ready.
Thank you. I'm Mylene Yao, co-founder and CEO of Unifi. I'm excited to be here at this Matter Startup Showcase. So first, a quick background about myself. Women's health, and in particular fertility care, has been a big part of my life. First, as an OBGYN, seeing patients that are suffering from infertility, and then as a scientist and researcher, studying the genetic control of embryo development and early pregnancy. And personally, as part of the 1 in 8 statistics, I experienced fertility treatments firsthand as a patient, and I'm very grateful to be a mom. Now, as CEO of Unifi, I'm seeing the pain points faced by stakeholders in the fertility space, and that includes patients, employers, health plans, and providers. Many aspects of fertility care are broken in our healthcare system. And I believe that the game changer is in using personalized prognostics. The word prognosis means knowing the probability of treatment success or outcomes. Prognosis, diagnosis, and treatments are the foundation of medicine, going back to ancient Greece. And today, we have the technological capabilities to bring AI and machine learning to personalized prognostics and to make patient counseling more effective and actionable. I co-founded the company with Professor Wing Wang, a world-renowned biostatistician and expert in AI and machine learning, to deliver on that vision. And Unifi is making fertility care more affordable, successful, and predictable. We're doing that by leveraging AI and machine learning to personalize counseling so that more women and couples can get to the treatment that they need without wasting time and money. Now, you all have heard how quickly the women's health market is expanding, and that includes the fertility market. It's projected to reach 40 billion by 2030, and 10 million women or couples need fertility care to have a family. And globally, that number is 100 million. IVF is the most effective and safest treatment available to these patients, and over 8 million babies have been born from IVF. However, there's a big problem, and that is less than 3% of patients use IVF, and most patients cannot afford several cycles to maximize their chances of success. IVF costs $10,000 to $20,000 per treatment, and on average, about half the patients may need several cycles to be successful. And many patients do not have full insurance coverage for IVF, and the out-of-pocket cost could be enormous. No other consumer-paid service has this degree of financial risk. Patients are emotionally and financially devastated after one failed treatment. And in that situation, even patients who can afford the treatment or have coverage may drop out of treatment without realizing the chance of having a family. Now, what is Unifi doing about that? we have developed a highly scalable AI machine learning platform that is validated for each clinic. And our flagship product is the Unifi pre-IVF report. And this pre-IVF report provides personalized and accurate information about live birth outcomes for each patient. And fertility specialists are using this report to counsel patients based on their personalized prognosis. What we're seeing is that patients that are counseled with the Unifi report have a much higher chance to actually access and proceed on to the treatment that's recommended by their doctor. And as a result, we're projecting that this number of live births is increasing by about 5-fold. And what is already validated is the access to treatment after being counseled. And right now we have preliminary results to indicate that live birth outcomes are also increased. And we'll be having more results in the coming months. Patients that are and that is our provider solution right now. And these are, the statistics that are summarized based on business analytics that we're doing with our providers. And this is a trend that we're seeing across the clinics that we're working with, where this platform is being used in 15 states by fertility specialists. And we've now assembled a commercial and product team led by experts, and we're very excited to be scaling this effort. We just recently raised a Series B round, and we're still in the middle of raising. Tell you a little bit more about that in a minute. And very exciting aspect is that we're also realizing what we've done is we've created a value-based program for IVF, and we can really translate that to health plans and fertility benefits and employers, so that we can really scale this access to information and personalized prognosis to help more couples access treatment. And this, both the provider team and the employer teams at our company are really supported by an amazing team of engineers, data scientists, communications and business experts. And we are looking at finishing the Series B fundraise. It's a $10 million round. We've raised $6 million so far. And we're looking at 3 specific addressable markets that I've mentioned: the provider solution, employer solution, and the patient solution is ongoing development of new AI machine learning tools that will also support new genomics tests. And this is the future that we're looking at. We're very excited to be really bringing better fertility care to more patients. Thank you.
Thank you, Maylene. Panelists, you are now able to ask questions.
So the current model is just going to the providers and the REs is what it sounds like. That's where you've started. And they're using that to help coach and guide the patients, which makes a lot of sense. I'm going to say just a few things. I think I like that you do this up to 3 cycles. From an insurance perspective, we know that, when employers cover IVF, they tend to do, up to 3 is actually becoming more of a standard. Some I would say will go up to 6, but 3 seems to be kind of that sweet spot of willing to cover for fertility. So I guess, one of the things that I would ask is, while going through the providers does make a lot of sense from a science perspective, I know a lot of friends, and if I could say even personally, have tried to do something like an appointment with an RE, and sometimes it takes upwards of 3 months, 4 months before you're even getting in the door there. What's the plan to actually go directly to the patient? Have you thought about how you're going to maybe, because something as simple as this report with maybe some level of counseling around it could actually just help an individual make the decision of, do I need an RE or not? Am I going to pursue some other options, right? So what's the plan to get directly to the women that are desperately looking forward to this information?
Right, yeah, definitely get that. And, we started with this B2B business model so that we could really get firsthand experience from the doctors and the patients so that we can make sure a product is delivering on the clinical outcomes.
Totally.
But definitely want to really, any way that can make this more accessible to patients would be great. And we're looking at all different ways and testing different methods. And as an example, we've actually established a fertility concierge, and we believe the human professional knowledge on the human professional is also very important in this, not just the AI. And so there's definitely a way to test, giving this reports to patients who don't yet have a doctor. And so with the Series B funding, we're able to test a few maybe regional models to try that out. And also, I think partnering with, health plans and maybe fertility benefits programs can also help increase access to more patients. So we're also looking to, build those partnerships and get that access out. So I think all of these are going to be possible now. We've already built the infrastructure, we have the technology and the human professional teams to be able to try these different methods.
Awesome.
And what's involved in getting a report? Is it a blood test? Is it how do you get to the percentages that you get to?
Right. So currently, this is based on, this is standard clinical diagnostic workup. So some are blood test results, some are reproductive history, and just, basic questions that the patients and the couple can answer. So all that's really needed is a couple of lab results in addition to a questionnaire. And that's why, going to consumer is definitely within reach. And so we've built it in the way to allow readily accessible information to be used to run this machine learning.
Okay, thank you.
Oh, Sherry, I think you're muted.
I clicked it twice, sorry. So I just want to make sure I completely understand how the individual consumer would interact with the product. So right now it would be accessed through their provider. So in the future, if somebody, how do you envision that in the future, where an individual, how they would interact with you, how that would, if their provider didn't have a linkage with you, how would that look?
Yeah, and currently we have a network of providers, and for providers who are who want to participate in this network to open up to consumers, that would and I think many of them would be very excited to do that. We definitely could have an online platform, whether it's an app or online. Those are the different things that can be tested, where a patient can access our system and our fertility concierge and get that human professional level of not necessarily a medical doctor, but a fertility nurse, a fertility expert that can give them holistic counseling and also be able to provide and walk them through running of the Unifi report. And then, should they be interested to then seek care with a fertility specialist, we can also help them connect to various specialists as well.
Great, thank you.
That makes so much sense the way you positioned it, because I think one thing that happens today is, lots of women will go get a modern fertility test or do something on their own. And yet when they go to an RE, their RE is repeating a lot of that same work. So they're actually paying for it twice. And a lot of people aren't actually covered for this. So you pay the $250 out of pocket to do your own stuff. You get a sense of it. And then you actually go to the RE, and you might be paying, upwards of $1,000 for that initial consultation with some of the same stuff. So I was just going to say to what we've been talking about moving this more into the consumer's hands. I do think in doing that, you don't want to lose the link to the provider themselves, because the worst of the world is to have someone redo something and, just charge a person twice.
Definitely, yes, and we definitely see that, and we want to really help to eliminate that kind of wastage as well. And we also feel from what we've seen that holistic counseling is very important, because maybe not every patient needs the same treatment or they need to head down the same path. But we really believe that they need to be best informed. If you pursue this or that, these are the things that you need to think about. and really help everybody know so that nobody regrets the decisions. A lot of times we hear women who say, well, I wish someone had told me about this or that option and I found out too late. And those are the things that we really want to avoid and really can avoid. And I think partnering with employers would also really help that, so that more women could have immediate access or know that, oh, this company is vetted, I should go to the system, because there are also, many, there are many, tools, online tools that are not really that credible.
And one quick question on the product itself, on the AI itself. Why just IVF%? Like, have you thought about doing natural versus IUI versus IVF? Because I think women are obviously thinking about all of those as
actually on our report, there is that comparison. And so, and it really is personalized. If that patient is also a candidate for IUI treatment, it will give that comparison as well. And also the comparison of, what if you don't do treatment? What are the chances that you would conceive on your own? So those are all very important questions.
Okay, makes sense.
Do you have any other last minute questions for Maylene? Wonderful. Well,
thank you.
Thank you. So that concludes our program for today. So thank you so much, Megan, Maylene, Megan, and Liz, for sharing your incredible solutions with our audience today. And thank you so much to our panelists, Sarah, Supriya, Sherry, for asking really probing questions and sharing your valuable insights. And of course, thank you to all of you, our audience, for joining in. And I hope you all have a great rest of your International Women's Day.